In a first, India has reported 5 cases of Cytomegalovirus, or CVM in short, related rectal bleeding in COVID immunocompetent patients, reports PTI quoting a report by Sir Ganga Ram Hospital, Delhi on Tuesday. According to Professor Anil Arora of Sir Ganga Ram Hospital, during the second wave of the COVID-19 in April-May 2021, the hospital saw 5 cases of CMV infection in otherwise immunocompetent patients with COVID-19. These patients presented with pain in abdomen and bleeding in stools. These patients presented with an average of 20 to 30 days after the diagnosis of COVID-19. None of them had other predisposing immunosuppressed states accounting for this viral infection, said Dr. Arora. He said that COVID infection itself and the medicines used for its treatments, that is steroids, do suppress the immunity of patients and make them susceptible to uncommon infections with varied presentations, and one such opportunistic infection is CMV virus. Cytomegalovirus exists in 80 to 90% of the Indian population in asymptomatic form, as our immunity is strong enough to make it clinically asymptomatic. Clinical presentation with symptoms secondary to CMV is usually seen in patients whose immunity is compromised, he informed. But in our series, all patients presented with low lymphocyte count, that is 6 to 10% as against a normal of 20 to 40%, indicating card-induced suppression of immunity, predisposing them to symptomatic reactivation of CMV infection, he added. He noted that out of 5 cases with an age group of 30 to 70 years were from Delhi NCR, 4 had presented with a lower gastrointestinal bleed, that is bleeding in stools, and 1 patient presented with intestinal obstruction. 2 of them had a massive bleed, 1 requiring emergency life-saving surgery in the form of removal of the right side of the colon, and 1 of them has succumbed due to massive bleeding and severe COVID chest disease. The other 3 patients were successfully treated with antiviral therapy with ganciclovir, added Dr. Arora. News Desk, Kaumudi English.